The moral right to health care. I am the compliance officer for Better Health Hospital, and I will be discussing the moral right to health care and providing good health care to all patients. The overview of the presentation, we will be discussing is healthcare a moral right, principles of ethics in healthcare, resource allocation, and cultural competency. Is healthcare a moral right? As of right now in the United States, healthcare is not considered a human or a legal right. It's considered more of a moral responsibility. The United States is the only developed country in the world that does not legally guarantee healthcare for everyone. Why is this? Some people argue that it is not the government's responsibility to provide access to care for everyone. The main way to access health care is by paying for it mainly through health insurance. However, many people can't afford adequate health insurance. So what can we do? Healthcare may not be considered a legal right to patients, but each patient should still be treated with respect and dignity. There's a set of principles that all healthcare professionals should abide by, and each principle should be in effect at all times. The principles of healthcare ethics consist of autonomy, which is to honor the patient's right to make their own decision. Beneficence, which is to help the patient advance his or her own good. Non-beneficence is to do no harm to any patients. And justice is to be fair and treat each patient's case alike, similar cases alike. These principles should all weigh equal in importance. And the core principles of healthcare ethics is our sense of right and wrong and our beliefs about rights we possess and duties we owe others. We have to think carefully about the ethical aspects of healthcare to help us make choices that are right, good, fair, and just. And let's talk about resource allocation. The first statement in the principles of ethics of the American Medical Association is physicians should merit, quote, physicians should merit the confidence of the patients entrusted to their care, rendering to each a full measure of service and devotion, unquote. Deciding who should receive certain treatments and procedures and how they will be paid is a huge challenge and burden in the healthcare world because oftentimes scarcity of resources such as equipment, beds, drugs, time, or excessive numbers of persons in need make it difficult, if not impossible. In an environment with rising costs and increasing competition, the managers of a healthcare facility need to contend with humanitarian versus monetary conflicts and thus have to address the trade-offs arising from this resource allocation problem. The quality of the provided healthcare and the monetary aspects of the problems are often interwoven, yielding an even more delicate situation that requires being handled with care. Applying economic principles as well as ethics and morals when creating allocation plans. No patient will be refused treatment and every patient will be assessed and stabilized. A selective approach will be taken and a strategic plan will be set in place for patients needing long-term or costly treatments. Cultural competency has been defined as an ongoing commitment of institutionalization of appropriate practices and policies for diverse populations. Studies reveal that as of 1999, 28% of the U.S. population was a member of a racial or ethnic minority group, and it is projected that by 2030, 40% of the U.S. population will be members of an ethnic or racial minority group. Barriers due to cultural incompetency in the healthcare affects communication between providers and patients of different racial, ethnic, or cultural backgrounds, which leads to poor healthcare. Establishing programs for minority healthcare leadership development and strengthening existing programs and hiring and promoting minorities in the healthcare workforce will help greatly with this issue. In conclusion, as a society, we cannot possibly commit all the money and resources it would take to satisfy everyone's healthcare needs and preferences. However, we can commit ourselves to providing the best care possible that is within our means, regardless of economic status, gender, sexual preference, income, or race. We have to think of patients as human beings and treat them as we would want to be treated or treat our loved ones. Ideally, all persons should have access to a decent minimum of health care necessary to sustain life, prevent illness, relieve distress and disability. Making good judgments in resource allocation, excellence, diverse management, respecting and acknowledging each patient, good communication, incorporating healthcare ethics and the principles, and personal morals and ethics are the best tools to providing good care to patients. This is what this hospital will stand for and abide by at all times. Thank you.